Hey guys, welcome back to the nursing channel. My name is Sam once again. So I'm making this video in direct response to Arya Patel. She wants to know, how do I become familiar with the terminology that's used in the case management department? So Arya is a floor nurse right now, and she's planning on transitioning into becoming a nurse case manager. And I'm sorry guys that I'm not looking at the camera. I'm currently driving to work right now. I don't want to be late, but I also want to make sure that I answer all of your guys' questions and I don't leave anybody unnoticed or with questions unanswered. But anyways, I'm probably not setting a good example right now, but anyways, to answer Arya Patel's question, how do I become familiar with the terminology used in case management? What resource can I use? The best resource you can use is the Medicare website. I cannot stress that enough. The Medicare website is the gold standard that is used within the case management department. That's where we base most of our actions off of, because Medicare is a federally funded insurance program for U.S. citizens, for those who qualify. Some of the qualifications are you have to be 65 or older, or 64 and a half if you want to get technical. Have end stage and another qualification is if you have end stage renal disease, you may qualify for Medicare, or if you have other medical issues. But yeah, that is what we use. That's what we base most of our actions off of. And so if you really want to become familiar with the terminology used in case management, go to the Medicare website and look up the following terms. Look up, what is a code 44? Look up, what is Medicare Part A? What is Medicare Part B? What is Medicare Part C? What is Medicare Part D? What does each Medicare subdivision cover? What does Medicare Part A cover? Does that cover inpatient hospitalization? What does Medicare Part B cover? Does that cover SNF services? So if a patient left the hospital and went to a skilled nursing facility and they had Medicare insurance, Part A and Part B, which part of Medicare covers skilled nursing facility treatment? Okay. Look up, what is a Medicare important message? Okay, and look up, what does it mean to be under an observation status? When the patient gets admitted into the hospital, what does it mean to be under observation status? How long can a patient remain under observation status? How many days for a patient with Medicare, how many days can they stay in the hospital without having to pay out-of-pocket cost? After that period, how much do they have to pay out of pocket if they don't have a secondary or supplemental insurance? Another question you may ask is, another topic you want to research in the Medicare website is, what is a 2 midnight stay? Why is this important? If a patient feels that they're being discharged too early, can they contest the discharge? Can they appeal the discharge? And what are the steps for them to appeal the discharge? Is there a number they can call? What is that number? There's an agency that Medicare uses called Livanta. It's spelled Livanta. What is a MOON, Medicare Outpatient Observation Notice? What are lifetime reserve days? What does it mean to get prior authorization? What is DME? What does that abbreviation stand for? durable medical equipment? What is the criteria for a patient to qualify for home oxygen equipment? What is the criteria that Medicare uses so that a patient can qualify for home oxygen equipment? How much of a patient's care is covered under Medicare Part A? What is the difference between outpatient treatment and inpatient treatment? So these are some of the terms that I'm throwing out that you guys should research. That way, any of you guys thinking of going into the case management department, once you guys can research these words, and once you guys get into the department and you guys hear these words, you guys are already going to be familiar with this information, and it's going to be a really smooth and easy transition for you guys. Some of your peers might be impressed with you that you don't have any previous case management experience, but you're familiar with these terms and these words. Also, you want to look up another word that just popped into my head. Look up, what is a skilled need? What are the requirements for a patient from the hospital to get admitted into a skilled nursing facility? Okay, they need to, and I'm just going to answer that question briefly. So a patient to get admitted into the skilled nursing facility with Medicare insurance, and the reason why I'm saying Medicare is because the majority of patients admitted into the hospital primarily consist of Medicare patients, either Medicare or Medi-Cal, okay? And case management, if you don't know, case management is about, the basis of case management is financial stewardship, okay? You're indirectly managing the finances of the hospital by the type of care coordination that you do. For instance, a patient that gets admitted into the hospital and they don't have a discharge plan and they're medically stable, they can go back home. However, they don't have a place to go to, they don't have any family support. This individual needs extensive wound care, but from an acute care standpoint, they're ready to go home. They just need, some dressing changes and wound care. But other than that, they're pretty much stable. We're not going to keep them in the hospital for any more days because the hospital's losing money, because they can get another patient that's actually acutely ill, and then Medicare will reimburse you. But if Medicare sees that there's no real medical necessity for the patient to remain in the hospital other than something that can be managed on an outpatient basis, then Medicare will not reimburse the hospital for the services that they're providing to the patient. Even, I don't know if you guys are familiar, but a patient room each day is a few $1,000s. So the hospital's losing money. So as a case manager, you have to come up with a discharge plan that's appropriate for the patient. Okay? So the terms and some of the terminology and the words that I used, look those up, use the Medicare website, become familiar with these words, because Medicare is the standard for case management. Let me know what you guys think. Hope this response helped answer your question. And if you guys have any other questions, feel free to comment below. My next video will be a video answering what is utilization review and how does that affect case managers, and what role do case managers play in doing utilization review. Okay, so I'm going to give a breakdown of that. Like I said, I'm driving to work right now. I'm probably not setting a good example by making a video and driving to work, but I want to make sure I answer all of your guys' questions. So my next video will be a video on utilization review, because when I started case management, I was like, what the heck is utilization review? I was unfamiliar with any of the words being used in the department. I was a blank slate, guys, and I wished, and I remember going to YouTube and trying to see if I can find videos on anybody that talked about nursing case management, and all I saw was white-haired individuals that were talking about nursing case management, but they didn't even go into detail. They didn't even give me advice. It was just like a generalized video that did not help me in any shape or form. So I want to be that individual, that nurse case manager that gives you the spiel, that gives you a heads up, that can give you advice on how to prepare and become a good case manager. So I hope this video helps. Like this video if you like it. If you don't, give it a thumbs down. Give me a reason why you don't like the video and how I can improve it. Yeah, hope you guys have a great rest of your day. I'm headed to work. Just wanted to make sure I answered your guys' questions. Take care. I'm out.